In this video, we will walk through the steps necessary to test a strategy proposal, compare its possible outcome to other proposals, and diagnose the results to identify opportunities to improve the proposal. We invite you to follow along in the ReThink Health model as we demonstrate its use. Before we begin, please note this model is intended not for predictive purposes, but as a way for diverse stakeholders to come together and explore the relative potential of various combinations of initiatives that can be implemented at the regional level. To begin your exploration, click on the Create Scenario tab. It is here that you will be able to select the initiatives and funding options that you would like to test. The simulation includes 23 initiatives that are typically under the realm of control of those pursuing regional health reform. We recommend that you carefully read the intervention description before selecting any initiative. You can review full descriptions, including details on cost and timing of implementation, by mousing over each initiative and hovering over its question mark. You will start with innovation funding of $24 million each year for 5 years for a total budget of $120 million. $24 million is 1% of the annual healthcare costs for any town, an average American town of 300,000. Additional funding options include shifting to contingent global payment systems and reinvestment of a portion of cost savings. The funds can be used to pay for initiatives which range from those addressing population risk, like environmental hazards and crime, to those improving quality of care, like encouragement of self-care and reductions in hospital infections. The initiatives also include efforts to increase the capacity of primary care providers and hospitals, as well as more direct reductions in cost of healthcare through initiatives like increasing pre-visit consults and expanding the use of hospice. In this demonstration, we will start by testing enabling healthier behaviors. Enabling healthier behaviors means both to promote healthy practices and to stop unhealthy ones that can lead to illness or injury. This initiative encompasses a variety of behaviors such as smoking, physical inactivity, poor diet, unprotected sex, alcohol, and drug abuse. This initiative lowers the fractions of people with high-risk behaviors, which in turn leads to reductions in the prevalence of both physical and mental illness, lower likelihood of urgent events like heart attacks, and decreased need for medications for lifestyle-related disorders such as hypertension and high cholesterol. The full cost of an effort to enable healthy behaviors is assumed to be $100 per person engaging in risky behavior. That cost assumption, as well as many others for each initiative, may be modified as appropriate by selecting the Assumptions tab. We recommend that these assumptions not be modified until the later stages of your exploration, and in some cases, your facilitator may disable your ability to modify them. To select healthy behaviors, return to the Select Initiatives tab and simply check the box. The selected initiative will appear on the right. For each initiative selected, unless limited by your facilitator, you will have a number of decisions to make. The percentage you select indicates the combination of reach, intensity, and cost for the given initiative. A value of 100% implies that you are going to direct it at the entire population at the maximum feasible intensity with the full recommended investment. A number less than 100%, which you can choose by moving the slider, implies either that you are targeting a specific subset of the population or that you will make less than a full-out effort on the initiative, thereby cutting the ultimate cost. For purpose of this example, we assume maximum effort of 100%. For some initiatives, as in this one, the simulation allows you to concentrate your efforts within a subgroup of the population. For healthy behaviors, as explained in the definition, you can choose to focus on only the disadvantaged population or on specific age groups by clicking the appropriate box. You would still set your initiative to 100% to maximize your effort, but the investment would be concentrated within the smaller population. For purposes of this example, we will not limit our effort. For each intervention, you also have the option of delaying the start. This is done by using the drop-down menu to change the start year. For purposes of this example, we will assume that the initiative is starting in 2015. When you are satisfied with your selection, you may add additional initiatives. However, we recommend that you begin by considering individual initiatives because it will be easier to understand the results as you learn the system. For this example, we will use only one initiative. In addition to assumptions and initiatives, there are also a number of trends that can be changed in the model. These can be found by selecting the Establish Trends tab. Trends are typically outside of the control of the local region and don't result in any investment costs. These include expectations for the economy, the healthcare inflation rate, the number of primary care slots, changes in uninsurance, and local hospital occupancy goals. We recommend that these trends not be modified until the later stages of your exploration process, and in some cases your facilitator may disable them. At this point, we have fully defined our scenario of enabling healthier behaviors, with innovation funding of $24 million per year each year for 5 years. When using a dynamic simulator for strategy development, it is important to not treat it like a game. One should take some time and try to think through policy implications prior to hitting simulate. We recommend an exercise in developing a hypothesis about the effect that the intervention will have on important metrics. This can take the form of drawing behavior charts over time. When you are ready, scroll down and name your scenario. Because you may wish to refer back to the scenario, it makes sense to give it a descriptive name. In this case, we are going to name it Healthy Behaviors. After you have named your scenario, click on Save and Run Scenario. The simulator should calculate fairly quickly. If there is a delay, it is either a short-term anomaly or your internet access may be sluggish. Once the calculations are finished, you will be directed to the Combined Score page under the Compare tab. This page shows the score of the current scenario. This score represents the sum of progress on cost, deaths, quality of care, equity, and productivity. Each of these performance measures can have a score between 0 and 100, resulting in a maximum score of 500. If you select the Breakdown Radio button, you can see the score for each of the individual performance measures. The next tab, labeled Cumulative Performance, shows the actual baseline value of each of the key performance metrics and the percent change from the baseline achieved by your scenario in 2040, which is the end of the simulation period. You can select the radio button labeled Actual Values to see the actual values rather than the percent change. When more than one scenario is shown here, the color represents the degree of relative change to the other selected scenarios. The key at the bottom shows what the colors mean. In general, greener is better and red is bad. Please do not stop here. This simulation tool is not intended to be a black box or simply a game. Instead, it is intended to help you understand the health system better so that you can make better policy choices and build more effective strategies. To understand the system, you're encouraged to peruse the more than 200 graphs that you can find by clicking on the All Graphs tab. These graphs are categorized by areas of interest, like net costs, health, costs, and care. If you select any of these categories, you will see that there are a large number of possible graphs underneath. The most commonly used are placed at the top for easy access. For enabling healthier behaviors, we will start by taking a look at its direct effect on high-risk behavior. But before we do that, let's think about how this intervention will affect high-risk behavior. Do you think it will stay the same? Do you think it will immediately improve and stay steady at this new improved level? Do you think that it will start slowly but improve more rapidly over time? Or do you think it will do something else? Once you have made your expectations for behavior explicit, you are ready to see what will happen in the simulation by reviewing the graph. Is this the behavior you anticipated? Some of us expected the fraction of the population engaging in risky behavior to fall permanently from the gray baseline. But instead, as the red line shows, the fraction engaging in risky behavior falls only in the short term and begins to rebound to the baseline in the longer term. Interesting. The effect of our program was unsustainable and it is important to understand why. If you would like to dig deeper to understand how to improve performance, you can explore the Diagnose tab. Here you have a variety of tabs available to you. The Key Indicators tab allows you to see performance on a wide array of metrics. In this case, we see a small positive result for all key metrics indicated by the green bar. We can explore graphs of each of the variables more deeply by clicking on one of the variables. We also have the Pitfalls tab, which is a very good place to start when trying to understand what can be done to improve your proposal. This provides a summary of some of the pitfalls inherent in your scenario. In this example, we see that there is an issue with unsustainable financing. Enabling healthier behaviors is shown to require an investment of between $15 and $25 million each year throughout the simulation period. On this next graph, we can see that we started to spend on healthier behaviors, but the initial innovation funding of $24 million per year for 5 years dried up, and in later years we did not have enough to fully fund the effort. This explains why in the previous graph we saw risky behaviors return to the baseline in the long run. So while we hoped the Enable Healthy Behaviors initiative would have a profound, long-lasting effect on risky behavior and a multitude of health metrics, instead we see strong short-term progress that rebounds. And the long-term improvement after a decade of no funding, though still visible, is minimal. When the funds were used up, the program stopped and risky behavior began to return. So we have learned that enabling healthy behaviors has great potential to improve the situation, but it requires substantial and ongoing funding. We may want to think more deeply about how to finance such an endeavor. There are a few other tabs that may be of interest under the Diagnose tab. The Spending and Savings tab provides a quick overview of results related to the cost and return of the project. The Stakeholder Impacts page, where you can get a quick overview of the impacts on payers, employers, and care providers, may also be useful. And the Compare Current tab is where you can find a variety of graphs on the current scenario. This is mostly useful for establishing the baseline. Perhaps we can do better with other initiatives. Let's return to Create Scenario from the menu bar at the top. This will bring you to the screen for inputting new initiatives. The last scenario you ran will still be in place. As you can see here, Enable Healthy Behaviors is still set at 100%. In some cases, you may wish to simply modify your last scenario, so this is helpful. However, in this example, we would like to start fresh. To do so, either unselect the Healthy Behaviors initiative or look on the bottom of the screen and click Reset to set all levers back to their default. For the second scenario, we would like to test the Post-Discharge Care initiative. This initiative is in the Cost category near the bottom. Mouse over the symbol for Improve Post-Discharge Care and select the question mark to pull up the definition. This initiative is the improvement of post-discharge care to reduce hospital readmissions. It includes the reduction of the risk of hospital admissions through improved discharge practices, including medication reconciliation and more referral to home health care and skilled nursing facilities for rehab. Several further consequences, which are indirect effects of the actions above, are to reduce hospital utilization and costs, but increase utilization and costs of home health care and nursing facilities. The initiative takes an average of 1 year to implement and requires an initial investment of $3 million and continued annual investment of 10% for ongoing maintenance. Select this initiative by checking the box. Leave its level of effort at 100%, starting in 2015. We will also leave the default funding. Now enter a descriptive run name, like post-discharge, so that you can more easily find this run later and click Save and Run Scenario. We can now see a comparison of the two scenarios, healthy behaviors and post-discharge care. Despite the fact that healthy behaviors was underfunded by 70% as shown here, it actually performed better than post-discharge care on the 5 metrics that we care about. Though, given the vast difference in cumulative spending, it looks like we might be able to add other initiatives to boost performance of the post-discharge care initiative. Note that the simulation will automatically add each new scenario to the compare chart. Comparing results of various runs can be a powerful way to learn. If you would like to add or remove scenarios from the display, open the gray Select Scenarios tab and select the ones you want. When you are done, click on Finished Selecting at the bottom of the window. If the scenarios you ran are not there, you should go to the Manage tab to manage the display of your scenarios. Let's take a look at the spending versus indicated graph under All Graphs. You can find that under the Pitfalls category. As you can see, for healthy behaviors, we see the heavy sustained early spending falling off precipitously when the funds dry up. While for post-discharge care, in blue, we see continued financing throughout the simulation, as the initial budget is sufficient to cover the expense. Let's also look at a few more graphs. On the key indicator page, which is under Diagnose, we see that the post-discharge care initiative has a tremendous impact on the readmission rate. If you click on the variable, you can see a very interesting comparison between the two. Healthy behaviors has no impact on the readmission rate, but post-discharge care has a dramatic impact. But while post-discharge care reduces the cost of hospital readmissions, it actually increases the cost of home health care over the baseline. We can see this under Costs, by subgroup, by component, home health. In this case, the cost of home health care is substantially larger under the scenario with post-discharge care than it is in the scenario with healthy behaviors or in the baseline. This is because enabling healthy behaviors reduces the use of home health care by increasing the health of the population, lowering disease prevalence, and thereby lowering the relative need for home health care. It should be becoming clear that there are very different mechanisms by which each initiative creates change. And part of the purpose of this tool is to help you to start to build an understanding of all of these connections and the various trade-offs inherent in the different initiatives. It is essential to consider these different mechanisms when interpreting metrics like this one, where the pattern and direction are opposite, but both reflect success for initiatives in different regions of the system. Hopefully, these two experiments have revealed further areas of inquiry. For example, you might try to combine these two initiatives or explore how to fund the behavioral initiative more fully and more sustainably, or you might consider something else to add with post-discharge care. We encourage you to continue further testing on your own and with colleagues. As you identify new scenarios, we encourage you to evaluate them and select your favorite. This can be done by opening one of the gray Select Scenario tabs, or by opening the Manage page and selecting the heart for your favorite scenario. This concludes the mechanics video of the ReThink Health simulation model. You are now ready to use this tool to rethink health. If you are a facilitator who will be using this with a group, please get in touch as we have additional resources available to make your experience smoother.